Assalamualaikum warahmatullahi wabarakatuh. Today we are going to present the slide. Smoking cigarettes a leading cause of preventable deaths in Malaysia. This is exploring cases because of cigarettes through the lens of SDG 3. This slide will be presented by me, Syaratul Aiza, and three other members, which is Nadia, Anis, and Farah. For the introduction to SDG 3, good health and well-being, Malaysia SDG 3 efforts build on its strong healthcare system, which has significantly improved maternal or child health and controlled infectious disease. However, the nation now faces growing challenge from non-communicable disease (NCDs), road injuries, and ensuring equitable access to healthcare across all regions. Achieving SDG 3 by 2030 requires to continue investment in health, promoting healthy lifestyle, and addressing new public health threats to ensure well-being for all nations. Next, the current cigarettes in Malaysia is in 2023, 19% of Malaysian adults, which is at 4.8 million, smoke, with men 35.7%, significantly higher than women, 1.5%. This marks a 70.7% decrease from 2011. Next, the National Health and Mobility Survey (NHMS) by 2022 found 6.2% of school teenagers smoke, with over half 59.7% obtaining cigarettes from commercial sources. E-cigarettes, which is vape, use rising from 0.8% by 2011 to 5.8% by 2023 for adults, and 1.1% by 2011 to 8.6% by 2023 for the 15 to 24 age group. So the tobacco caused an estimated 24.1 thousand deaths in Malaysia in 2021, which is the total deaths is 23.2%. The Ministry of Health aims to reduce smoking prevalence to 15% by end of 2025, supported by the Control of Smoking Product for Public Health Act 2024. Despite declining smoking rates, the rise of vaping, especially among youth, present a new public health challenge.
Next is the root of causes. There are 4 root of cause. Number 1 is nicotine addiction. Cigarettes are packed with nicotine, which is super addictive. Number 2 is friends and family. If your friends or family smoke, you more likely to try it too. Number 3 for the root of cause is easy to get. So the cigarettes are still pretty easy to buy, and sometimes you can even find the cigarette in supermarkets. It's cheap. Number 4 is stress and habit. Some people smoke to cope with stress or simply because it becomes a daily habit.
The current initiative for nicotine addiction is the generational engine. This is a huge new law. If you are born in Malaysia on or after January 1, 2007, you cannot legally buy cigarette or vape products ever. The idea is to create a completely smoke-free generation. Next, current initiative for friend and family is education youth. Program in school are teaching young people about the dangers of smoking and vaping to stop them from ever starting. There are also efforts to empower youth to be part of the smoke-free movement. Next, current initiative for easy to get is stricter rules and fines. New laws mean top penalties for shops that sell them to minor or break advertising rule. The initiative for stress and habit is integrated behavioral support and counseling and quick service, providing coping strategies and developing personalized quick plan.
Next is impact to current initiative by government. Despite the Malaysian government ongoing initiative to combat smoking, such as higher tax, stricter regulation, and public health campaign, the prevalence of smoking remains a significant challenge. These initiatives are designed to reduce the smoking rate, especially among young people, and prevent the numerous smoking-related diseases. However, there are various challenges and impact on their initiative that need to be addressed. The impact is First is tax and pricing. Higher tax on cigarettes aim to reduce smoking but have to lead to an increase in the illegal cigarette trade. The illegal cigarettes are sold at lower price, undermining the effectiveness of tax hikes. Second is public awareness campaign. Campaign like Say No to Cigarette raise awareness of smoking risks, limited effectiveness due to culture factory, peer pressure, and nicotine addiction. Third is regulation of public space. Banning smoking in public areas has helped reduce exposure to second-hand smoke. Enforcement is inconsistent, especially in rural areas. 4 is smoking cessation program. Government programs support smoking quitting through counseling and clinic. Limited access to their program, especially in rural or low-income area, lead to low success rate. 5 is illicit cigarette trade. The government is increasing penalties and border control to fight illegal cigarette sale. The illegal trade remains a major challenge, undermining government effort to reduce smoking. 6 is tobacco packaging and labeling. Traffic health warning on cigarette packaging aim to deter smoking. Smokers may become desensitive to warning, and illegal cigarettes often don't carry their warnings.
Next proposed program for this case is smoking prevention program for community in Malaysia. Okay, outline. First goal, second problem statement and important for sustainable development. 3 objectives, 4 methodology, 5 monitoring and evaluation mechanisms. 6 conclusion. Overview for this program is the primary goals to raise awareness about the major preventable causes of death in Malaysia and promote behavioral change through education, early screening and healthy lifestyle adoption. By identifying key risk factors and implementing effective prevention strategies, Malaysia aims to reduce the mortality rate associated with preventable disease and improve the overall quality of life for its citizens.
Next is the problem statement and importance for sustainable development. As we can see, total smoke by the gender for male is 4.21 million and for the female is 177,000. And for the total smoke by age from 15 until 24 years is 507,400. And for the 25 until 44 years is 653,200, and from the 45 years until 64 years is 176,400, and last one is from the 65 years above is 15,400. By educational, divided into non-formal educational, primary school, secondary school, and tertiary education. By occupational, which is self-employed, private sector, government servants, unpaid or homemaker, and the last one is retirees. By cigarette categories, is leaf cigarette as much as 9.1%. For the electronic cigarette or vape is 12.1%, and the whole is manufactured cigarette, which is 78.8%.
Next is the objective and expected outcome. Number 1 is to reduce smoking prevalence. The program aims to decrease the percentage of Malaysian adults and teenagers who smoke, building on the Ministry of Health target of 15% by the end of 2025. Number 2 is to combat nicotine addiction. By addressing the highly addictive nature of nicotine, the program seeks to support individuals in quitting smoking and prevent new users from starting. Number 3, to counter the influence of social circle. Education programs for young are being implemented to highlight the dangers of smoking and vaping, aiming to empower them to resist peer and family pressure. Number 4, to reduce accessibility of cigarettes. The program likely supports stricter enforcement of laws against selling tobacco products to minors and breaking advertising rules to make cigarettes least accessible, especially to young people. Number 5, to enhance public awareness and address cultural factors. The program aims to improve the effectiveness of public awareness campaign like Say No to Cigarette by addressing cultural factors, peer pressure and nicotine addiction that limit their impact. Lastly, to make health warnings more impactful, the program seeks ways to ensure that graphic warnings on cigarette packaging stay effective, especially since illegal cigarettes often don't have them.
Next is methodology. First, in methodology is community awareness and education. Conduct awareness campaign and school-based program to highlight the health risks of smoking. Next is partner with the local media influencer and NGO to reach body communication. Second is public health surveillance and data collection. Utilize national survey and WHO report to collect reliable prevalence data and analyze smoking trend based on the demographic, which is age, gender, occupation, and education. The third one is policy and regulatory assessment. Review existing tobacco control pollution and evaluate enforcement effectiveness and public compliance. The last one is behavior and cessation program evolution. Study the affection of smoking cessation service, measure community participation and relapse rate through healthcare support the channel. Next, monitoring and evaluation mechanism. For the monitoring, we can collect data on program participation, smoking rates, and community feedback through survey and interviews. We can to implement a real-time monitoring system to track the progress of participants in smoking cessation and health improvement programs. We can to conduct evaluation such as quizzes to assess the effectiveness of educational workshop. For the last one, we can measure the outcome of programs such as a reduction in smoking prevalence, improvement in respiratory health, and increase in non-smoking advocates among participants.
In conclusion, smoking cigarettes remain a significant public health challenge in Malaysia, despite ongoing governmental efforts to combat it. While there has been a decrease in adult smoking prevalence since 2011, the rise of e-cigarette use, especially among young, presents a new concern. Tobacco caused an estimated 24.1 thousand deaths in Malaysia in 2021, representing a substantial portion of total deaths. Key root causes of smoking include nicotine addiction, social influence from friends and family, easy accessibility of cigarette, and using smoking as a coping mechanism for stress and habit. Thank you.